Hello, I'm Dr. Caroline Novak of the VIP Medical Group, and I'm a specialist who works at the Vein Treatment Clinic. Today I'm going to answer the question, does cellulitis itch? The short answer is that yes, cellulitis may itch, but itching isn't usually the major symptom of cellulitis. If itching is the first thing you notice, you may have a different medical issue than cellulitis, such as an allergic reaction, vein disease, or a skin condition such as eczema. So what is cellulitis, and does cellulitis itch? Cellulitis is an infection that involves the skin and soft tissue just underneath the skin. Cellulitis is usually caused by bacteria, especially strep and staph. The most interesting thing is that both of these types of bacteria are what we doctors call normal flora, which means they are commonly found all over the skin at any time, even on yours right now. But before you rush off to douse yourself in an antibacterial hand sanitizer, don't worry. These bacteria only become a problem if they enter through broken skin. So risk factors for cellulitis include a cut or a scrape or a pre-existing condition like athlete's foot or chickenpox that weakens the skin barrier. In addition, if you have an autoimmune condition or diabetes, you may be at higher risk for cellulitis. If you have cellulitis, the first thing you might notice is redness and swelling in the infected area. Often the skin is warm to the touch. Most people feel a dull discomfort or pain. Cellulitis does not usually itch. More concerning symptoms of cellulitis include fever, rapid spread, or severe pain. If you have any of those symptoms, consider seeing a doctor right away. So if you have an itchy rash and it isn't an infection like cellulitis, what is it? Eczema, fungal infections, vein disease, and allergies can all cause skin inflammation, technically known as dermatitis, and itching. Unlike cellulitis, none of these conditions will improve with antibiotics or antibacterial ointment. Vein disease is quite possibly the #1 misdiagnosed condition. Patients with vein disease, formerly known as venous insufficiency, often have skin changes and swelling on their lower legs. In venous insufficiency, veins deeper within the leg do not carry blood efficiently towards the heart and blood pools in the legs. A chemical from the blood cells called hemosiderin seeps outward and is deposited just underneath the skin, causing a reddish-brownish discoloration. This can be very itchy. Spider veins, thin purple or blue veins that lie just underneath the surface of the skin, can cause significant itching as well. If the changes in itching have been present on your legs for a long time, they are much more likely to be vein disease than cellulitis. Another classic misdiagnosis is a contact dermatitis due to medications. For example, after a bad bug bite or a cut, many people with good intentions start to use an antibiotic ointment on the affected area. But many antibiotic ointments, especially Neosporin, actually cause significant skin irritation. I have many patients coming to me and complaining of an infection on a bug bite after using Neosporin. It's just a reaction to the medication. Simple care with soap and water is usually your best bet. So, does cellulitis itch? Rarely. If you notice a constant itching, consider what else could be the problem. If the affected area has a number of visible veins, your issue might be venous insufficiency, also known as vein disease. Visit www.veintreatmentclinic.com to learn more. I'm Dr. Caroline Novak. Thank you for listening today.